Hello, my name is Gwyneth Hinds. I'm a retired doctor and I'm now working as a Pilates teacher, but I spend a lot of my time talking to women about the menopause. Now, this is something that was part of my career for many years. And for the last 14 years, I worked in the City Hospital in the breast unit, and I was associate specialist there in the breast clinic, dealing with women who had breast cancer. And I would have been doing breast clinics when women would come in, and sadly I would have to tell them that they had breast cancer. And they would say, "Oh my goodness, I'm on HRT for the past month. Has that caused my breast cancer?" And they felt so guilty. And it was lovely to be able to say, actually, being on HRT for the last month has nothing to do with the fact that you have a breast cancer, because that breast cancer has been growing in your breast for a couple of years before it's got to the stage that we've been able to diagnose it. I also looked after the family history clinic, and I saw a lot of women who had a family history of breast cancer, and they were very worried that their HRT might increase the risk of getting breast cancer. And to be honest, going back, let me think, we're now talking about 14 years ago, whenever I was in my late 40s and I was going through the menopause, I wasn't so sure, should I go on HRT? And I was anxious about it. And actually, I kept on going with my symptoms for several months because I thought, oh goodness, it would be terrible if I then got breast cancer and I'd been on HRT. But then I did sort of become a little bit more subjective about the whole thing, look at the evidence, and then I decided that I would try it. Now, I think the good thing is that things have moved on in those 14 years. And certainly there's a lot more information out there now than what was 14 years ago. Like 14 years ago, there wasn't very much talk about HRT, and women were really very worried about it. And that's because there was a lot of research that had been done and came out about 2004 that suggests that HRT was going to increase the risk of heart disease, stroke, and breast cancer. And a lot of them women stopped taking HRT at that time. So it's important that we then look at the facts. Is there an increased risk of breast cancer for women who are taking HRT? Now, the simple answer to that is yes, a very little risk. And we're always, it's interesting how women are frightened about getting breast cancer. If they hear that their mammogram's abnormal, they don't sleep until they get to that clinic and told everything's normal. Whereas if you're told your cholesterol is high, you may not really be that worried about it. And yet heart disease kills twice as many women in the UK as breast cancer. But breast cancer is something that scares us silly. And the good thing is that we're treating breast cancer much better, and the vast majority of women who are diagnosed with breast cancer will actually survive for a very long time to die of something else. But there is that small risk. So that's what I want to talk to you a little about today, so that you have the evidence and what the risks are to help you make the right decision for you. And the thing is I'm not saying you all must take HRT, everybody's fine, it's right for everybody, but I want you to be able to make an informed decision with the right information. So you may be aware that if you've had a hysterectomy, you only need estrogen. You don't need estrogen and progesterone. And the good news is that all the studies of estrogen-only HRT shows that there's no increased risk of breast cancer at all, okay? And in some studies, it actually showed a decreased risk. Now, it's strange, isn't it? Because everybody thinks, oh, it's estrogen that feeds breast cancer. And like a lot of things in the medical world, it's not as straightforward as that. It is women who are combined estrogen and progesterone that have a slight increased risk of breast cancer. So we need to have that progesterone along with estrogen, because that protects the lining of the womb so it doesn't become thick, which could put you at risk of cancer of the uterus. So if we're taking estrogen and progesterone, then the studies show that there is a slight increased risk of breast cancer. Now, to do these studies, you need to be able to follow up women for 10, 15, 20 years. So that means we're always looking back in history. So the research we have today was done on the progestins and the estrogens that were being prescribed 20 and 30 years ago. We don't have the research that is now will be ongoing to see what the impacts are of the HRT that we're using today. But the good news is that so far the evidence is suggesting that the newer types of progestogen, and especially the micronized progestogen, which is less synthetic and is much more like the structure of this progesterone that our bodies would produce, has got less of a risk of breast cancer. So even when I'm giving these statistics, this is worst case scenario. And I would hope that in about 10 years' time, we'll have a lot more research that will show us that the HRT that's been prescribed today is even associated with less of a risk of breast cancer than what we thought. Now I'm going to share my screen. So let's hope when I press this button, the right thing comes. Oh, I'm sharing my screen. So this is what is a lovely headline to start off with. There is no increased risk of breast cancer with any type of HRT when taken for less than 5 years. So if you're taking HRT, it takes quite a long time for those additional hormones to have an impact on the way your breast tissue is growing. And a breast cancer develops in your breast really quite slowly. It's the sort of thing that we almost sort of think appears out of nowhere. All of a sudden we feel this lump, but that lump has been there for several years. So we know that you would actually need to be on HRT for more than 5 years before there would be any increased risk in the risk of breast cancer. So that means that all of us can, if we haven't had breast cancer, even if we've got a family history of breast cancer, that if we want to start HRT to see if it helps our menopause symptoms, that we can take it for 1, 2, 3, 4 years without having any increased risk of breast cancer to worry about. So that's good news to start from. Now, the other thing to remember is that what are the factors that increase the risk of breast cancer? They're mainly things that we can't do anything about: being female, getting older, and having a family history of breast cancer are the 3 important factors. But being female and getting older is the most important one of all. We've got a risk of having breast cancer at some stage in our life between of 1 in 8. 1 in 8 of us will have breast cancer at some stage in our life. But if you look at it, the chances of getting a breast cancer whenever you're 40, of developing a breast cancer within the next 10 years, is really quite small, 1 in 65. That means 64 out of 65 women will not develop breast cancer in their 40s. In our 50s, the risk begins to increase a little. So now it's 1 in 42, and then increases again over the age of 60. But you can see there again, that means 27 out of 28 women will not develop breast cancer before they're 70. But if we add all of those risks together, that's where you can then say the lifetime risk is about 8%. But the vast majority of this, that means if 8% get breast cancer, that means 92% of women are not going to get breast cancer. And there are things that we can do to reduce the risk of breast cancer, sort of maintaining a healthy weight, not drinking too much alcohol, and being physically active. And that will have a much bigger impact on reducing our risk of breast cancer and other cancers than anything else we do. And not smoking doesn't have as much of an effect on breast cancer, but obviously you're aware that for other cancers, that's important. But we do know that if we looked at all the breast cancer cases in the UK, that 2%, that's 2 out of 100, would be attributed to HRT. But the same research shows that there are other factors that increase the risk of breast cancer, and that being overweight, having a BMI over 30, increases increases the risk of breast cancer and can be attributed to about 8% of those cases. That's 4 times as many as the HRT. And again, regular alcohol consumption, probably above 25 to 30 units a week, is also going to increase the risk of breast cancer. And again, in this major study, they actually contributed excessive, it's not even excessive, moderate alcohol intake was actually causing 8% of breast cancers. So, you know, we don't really get worried about our breast cancer risk if we're overweight and we're having our G&T every night, but those are probably a lot more important than having our HRT. And when you think about it, being overweight has got other health risks, whereas HRT may have other health benefits, such as reducing the risk of osteoporosis. So it's important that we keep that risk in context, and that we make sure that the fear of breast cancer doesn't actually make us not look at this in a rational light. Statistics are always a difficult thing, and sometimes it's worthwhile looking at it a different way. So yes, we know that women over the age of 50 up until the age of 70 are at increased risk of breast cancer. So if you have 100 women who aren't taking HRT, there's 6 of those women are going to be diagnosed with breast cancer. So that means 94 are not going to be diagnosed with breast cancer. Now, if you took 100 women who are all taking HRT, estrogen and progesterone, remember, and they've been on it for more than 5 years, then of those 100 women, 8 of them are going to develop breast cancer. But 6 of them are going to get breast cancer anyhow. So there's only an extra 2 that are getting breast cancer as a result of being on HRT, estrogen and progesterone, for more than 5 years. Now, of those 8 women who unfortunately are diagnosed with breast cancer, who are taking HRT for more than 5 years, every single one of them is going to blame their HRT for their breast cancer, because we always want to have a reason why these bad things happen. So HRT has got the blame for 6 breast cancers that it had nothing to do with. So this is the reason why I think that we you know, even as doctors, we probably put more blame on HRT for causing breast cancer than what it actually deserves. So yes, there is a small risk. The risk is probably greater with the older progestrogens. That risk is only going to become a problem if we're taking HRT for more than 5 years. If we then stop our HRT, then that risk will go down to what it was as if we had never taken HRT. So it means that if you're sitting there today thinking, I want to try HRT to see if it helps my hot flushes and night sweats, that you can take it for up to 3 to 4 years, knowing that it's not going to increase your risk of breast cancer. And that's exactly the same, even if you have an increased risk of breast cancer because of your family history. Sadly, you have that increased risk of breast cancer, whether you take HRT or not. Now, I think the other thing I'll just put in here before I end is breast screening. We know that breast screening is a good way of finding small cancers and being able to treat them more easily. And that is available in the health service from the age of 50 onwards, and it's done every 3 years. But in Northern Ireland, we're really, really fortunate to have Action Cancer, who will offer mammograms to women who aren't having any symptoms in their breasts every 2 years from the age of 40 onwards. So that is something that is available to all women, and I would recommend to women, if they want to consider screening, and not all women want to consider screening, but if they want to consider in their 40s, that's available. So if you're going on to HRT in your 40s, it might be something that you would want to think about. But you don't need to get a normal mammogram before you start your HRT.